In today's video, we're going to be going over NCLEX practice questions. So if you want to learn more about how to answer different types of practice questions, you're going to want to watch this video all the way to the very end. And if you're watching this video on the replay or if you're watching this on YouTube, make sure you check out the descriptions for some of our resources. I do have a free training, a webinar where I go over and help you how to pass the NCLEX, especially if you failed it before. So if you're watching this on YouTube, check out the description. But if you're watching this here on Facebook, go ahead and comment the word webinar and we'll send you the link to watch that free webinar training. So let's go right into it. Hi, my name is Choma, or I go by Nurse Choma. I'm the founder of ChooseTheNursing.net, and we're here to help you succeed in your endeavors of becoming a nurse and pursuing thereafter. So today I'm going to go over with you some practice questions to see how well you're thinking critically and how you're able to answer these type of questions. Ready? Let's go and get started. So the first question says, a client with heart failure is prescribed furosemide. Which lab value should the nurse monitor closely? Is it going to be 1, hemoglobin, 2, potassium, 3, creatinine kinase, or 4, bilirubin? One more time. A client with heart failure is prescribed furosemide. Which lab value should the nurse monitor closely? Is it going to be hemoglobin, potassium, creatinine kinase, or 4, bilirubin, right? So really briefly, as far as this question, this one, you should know this one because when you have patients that have heart failure, their heart is not pumping very well. In fact, their heart's pumping very bad and ineffective. They have decreased cardiac output. So because their heart is pumping bad or poorly, then as a result, they tend to retain more fluids than they're supposed to. So patients with heart failure, you're going to see they're going to have a problem with edema. And if it's left-sided heart failure, then they're going to have more pulmonary issues. So that's why we give them a medication called furosemide, which is the generic name, or also called Lasix, which is the brand name, which hint on the test, you need to know furosemide, the generic name. So we give furosemide, and what furosemide does is that it helps to pretty much get them to pee out or get rid of all the extra fluids in their urine. So many times the doctor wants us to monitor strict I's and O's and put them like on a Foley catheter, or at least have like a very strict I and O monitoring that they're peeing and etc. So for this patient, when they're on furosemide, which is a diuretic that tends to get rid of potassium, it's going to cause their potassium levels to drop or become too low. So 2 is going to be the correct answer. All right. So you have to monitor the potassium levels for that reason. All right. Hopefully you got the answer correct. And if you want to, at any point during the video, if you watch this on the replay, you're welcome to stop the video, comment below, and let me know what you think the answer is. Okay, so here's the next question. All right, here's another question. So this question says, which client is at highest risk for developing a pressure ulcer? Which client is at highest risk for developing a pressure ulcer? 1, a 42-year-old with a fractured arm. 2, a 76-year-old on bed rest. 3, a 50-year-old post-appendectomy. Or 4, a 25-year-old that's receiving antibiotics. All right, so like I said, if you want to, you're welcome to go ahead and stop the video right now and let me know what you think the answer is, or go ahead and comment right now if you think you know the answer. So for this type of question, all right, what you have to pay attention to the risk factors. So here's one thing that I would challenge you, that would help you to do, one thing that will help you to do better with answering questions is to study risk factors of different types of diseases or problems. because what it is that the risk factors is pretty much kind of like embedded in the question or in your ability to strategize to the correct answer. So many times when you get those questions, especially when you get those questions that's like who's the most concerning or the most important or the best whatever, it's like what you have to do is that you have to count how many risk factors are in that specific patient profile, all right, in order to help you to get to the best answer. So going to this one, number 5, looking at the choices, we have, like I said, you have a 42-year-old with a fractured arm. So 42, they're pretty still mobile. They can probably get up and move around a lot. So the only risk factor that would make them at risk for a pressure ulcer is maybe like a limited mobility, but of their arm, right? Number 2, though, a 76-year-old on bed rest. Well, if they're 76, they're already elderly, so their skin is fragile. So with fragile skin, plus the fact that they're on bed rest, so they're actually supposed to not really move or get up, those are 2 risk factors that patient has that increases the likelihood of developing pressure ulcer. 3, a 50-year-old with post-appendectomy. So post-appendectomy, so here's the thing about this one. If they're 50 years old, they can still get up, walk, move around, right? They're not as fragile skin as number 2. Post-appendectomy, yes, post-appendectomy, yeah, they could be doing bed rest. But most of the time, actually, when we have patients, if we do some type of surgery in the abdomen area, one of the biggest interventions right afterwards is ambulation. So one of the things is that we actually want the patient to start walking and getting up as soon as possible in order to prevent what's the word I'm looking for right now? Pretty much is where the stomach, the bowel is not moving. So the reason why we want them to ambulate is to get their bowels moving as soon as possible so that they can eat soon and be able to drink fluids and etc. So for this one, and then the last one, number 4, the 25-year-old receiving antibiotics, he or she is moving around, is getting up. So there's 0 risk factors that would equate to pressure ulcer. So for that reason, that's why for number 5, the 76-year-old, number 2, would be the best answer. The 76-year-old on bed rest has an immobility and advanced age, which significantly increases the risk of pressure ulcer development. So that's one thing I would tell you is that when you have those questions, that anything that best, most likely, these type of questions, and it lists for you in the answer choices multiple patients, and some of the patients, maybe that patient, maybe that patient, but then all you have to simply do is just go through each choice and figure out which one has the most risk factors of that problem. And the only way you can really know that is if you study the disease process and you pay attention to the risk factors in the disease process. Okay, let's do another question. All right, let's see here. Let's do this one. Let's do this question. So this question says, a client is receiving heparin therapy and develops a nosebleed. All right. What action should the nurse take first? All right. So this is a priority question now. So here's the thing about these priority questions before I list the choices, is that many times a lot of the choices could be correct, meaning that you do need to do that intervention. But once again, the key word though is first. So which one takes a precedence over all the other ones? And there's a couple of rules you would use in the situation. 1, the ABC rule, right? Airway, breathing, circulation. 2, safety. So safety as in the sense of, okay, which intervention would be the most safe to help the patient with, right? And then 3, Maslow's hierarchy of needs as well. So what you have to do is you have to be aware of each of those strategies and then figure out which is actually applicable. So for this one, the choices are 1, stop the infusion. 2, document the finding. 3, administer oxygen. Or 4, lower the head of the bed. What do you think it is? Right? Once again, a client is receiving heparin therapy and develops a nosebleed. What action should the nurse take first? 1, stop the infusion. 2, document the finding. 3, administer oxygen. 4, lower the head of the bed. Now, many times, not every time, right? Another strategy, many times, not every time, anything that is passing the bucket or continue to monitor or don't do anything is usually the wrong answer, okay? So you can pretty much go ahead and throw out number 2 in this situation, especially if it's something, if there's a new problem that the patient develops, usually continue to monitor is not the answer unless whatever that new problem is isn't truly a problem, all right? So that's the first thing. The other thing too is, of course, we don't know the significance of the nosebleed. Like it could be, what if the nose is like gushing blood, or if it's just like a little bit of blood, you know, but you have to just assume that it's, there's blood coming out the nose, period. So the best answer for this one is going to be the first one. Stop the infusion, all right? Stop the infusion. Here's the reason why. Bleeding, because they're on heparin, right? So the biggest thing is that when they're on this medication, you have to look out for the side effects. And if they're having those side effects, that means that their body is less tolerant to that medication, and therefore it should be stopped, right? That's essentially what it is. So if you're ever not certain as far as, okay, do we stop the medication or we don't stop the medication? If it's an adverse effect, you stop it, right? If it's a side effect, then you treat the side effect, but you don't stop it. So bleeding is an adverse effect of heparin in this case. Bleeding is a potential adverse effect of heparin. The infusion should be stopped immediately to prevent complications, right? That's the reason why it's that answer. Okay? All right, awesome. Okay, so now let's keep on going. Let's do another question. And hopefully you're finding this helpful. Now, if you find this helpful, do not be shy. Go ahead and comment below. Let me know, yes, it's helping me. Yes, I'm learning something. Or post your questions below in the chat section, in the comment section. So the last question says, which finding in a client with COPD requires immediate intervention? All right, which finding in a client with COPD requires immediate intervention? 1, productive cough. 2, SpO2 of 82% on room air. 3, clubbing of the fingers. Or 4, barrel chest. All right, one more time. Is it 1, productive cough. 2, SpO2 of 82% on room air. And then 3, clubbing of the fingers. 4, barrel of the chest. All right, so many times, this is the type of questions that my students will tell me, oh, I always get it down to like 2 choices, but then I'm not certain what to do next, right? And so that's good that you are using the process of elimination. You gotta be careful with the process of elimination, because then you may end up eliminating the wrong choices. But you have to be aware of what you're eliminating and why. Once again, this could be another type of question where in the answer choices could be correct that one of them, would consider abnormal, but it's not abnormal for that diagnosis. So for this one, number 2 is the correct answer. The SpO2 of 82% on room air is the biggest concern. The reason why it's not the other ones, okay, so let me go over the reason why. First, let me give you the whole rationale. An oxygen saturation below 90% is critical and requires immediate intervention in a COPD patient, right? So anytime, whether it's COPD or any other problem, any other diagnosis, the goal for patients in general, like healthy patients that don't have COPD, is ideally 93% and above for the oxygen saturation. The goal for patients that have COPD, because they tend to have a lower saturation anyways, is going to be typically anywhere from like 89 to 92% minimum. It depends on the patient though, of course. But in this situation though, 82% is too low, all right? 82% is too low. That would be like an ABC rule, an airway problem. So that would be abnormal and you would pick that one. Productive cough, although it could require intervention, it's not more important than the low O2 sat. And then the clubbing of the fingers, that's a chronic problem with patients with COPD. And then the barrel of the chest, that's not something that we would be concerned about as well with patients with COPD, because that's typical as well with COPD patients. Be careful that when you're doing questions or when you're reviewing content, that you are able to differentiate the normal signs and symptoms for that diagnosis versus what would be now considered alarming, concerning, or a complication. Because many times when you get practice, when you do the NCLEX and you're doing questions, that is what it's going to test in order to see how much of a safe nurse you truly are. All right? Hopefully you found this video helpful. If you did, make sure you hit the like, follow, comment, subscribe button. If you're watching this on Facebook, you're welcome to subscribe to our page and become a paid subscriber in order to get access to more valuable content. And then if you want to, like I mentioned before, watch the free webinar training where I go over how to pass the NCLEX, especially if you failed the test. Then you're going to want to go ahead and comment the word webinar below in the comments here on Facebook, or if you're watching this on YouTube, go to the description in the YouTube to register for it for free today. Thank you so much for tuning in, and I'll see you the next time.